The case of the missing Middletown teen with Asperger's syndrome is putting a spotlight on this developmental disorder. So the big question exactly, what is this disorder? How does it affect people? So luckily I'm joined this morning by Hartford Hospital clinical psychologist, Dr. Laura Saunders. Good morning to you, doctor.
Good morning.
Thank you so much for being here.
Thank you for having me.
So can you just give us sort of an overall general, what is Asperger's syndrome? On our news reports concerning this young man, Nathan Carmen, we've kind of been calling it a high-functioning form of autism. What do you say?
That is correct. It is on the autism spectrum. It's considered a high-functioning form of autism. One of the differences in Asperger's from autism is that in Asperger's, there's normal language development. So there's no significant delays in language development like there is in typical autism.
All right, so if you're a parent at home watching right now and you want to look for these symptoms in your young child, is there anything that folks can look out for?
Yes, I think it becomes more apparent as these kids go through the developmental spectrum. So as they get older, you see that they have significant social skill deficits and they have communication deficits. They may have more restricted interests in activities. They may be more obsessive about one particular interest. So as they get older in, their latency age 3, 4, 5, 6, 7, 8, you really see that there's a marked difference between them and their same age peers.
All right, and we know that autism affects about 1 in 110 children. How many people are affected by Asperger's?
It's a smaller percentage of the autism spectrum, but it's a very significant percentage because really over the last 10 to 15 years we've become much more sophisticated about diagnosing it because it is much more subtle.
All right, so what is life like for somebody with Asperger's? This young man, Nathan Carmen, 17 years old, he's from Middletown, he went missing, he found his way to Virginia somehow, had a game plan to go on a scooter to Florida. Right. What was life like for him? Can you describe?
Well, obviously I haven't met him nor evaluated him, but I've worked with many individuals like him, and in general they have their set routines and their rituals, and the hope is that they're in a family environment where they're well understood. They have interests, they have things that they like to do, and they really like to use those preoccupations as much as possible. Someone like this, it's really important that you understand that they have interests and activities, and you allow them to develop those interests and activities.
Let me ask you this, because I know one of his interests and activities was a horse. He was carrying a picture of a horse with him when he was found, a horse his father said had recently passed away. Do we know anything about these folks with Asperger's, that they feel a special connection to animals or anything like that?
Because they have so many social skill deficits and they tend to prefer solitary activities, it would be fairly common that an animal would be a close companion or a best friend for them. That would be very common.
Okay, that makes a lot of sense. And just as a last question, doctor, any sort of therapy, counseling, what's available for people who have Asperger's?
I think what's critical in these for these individuals is social skills training. They often want to make some forays into friendships, and they don't have the ability to do reciprocal communication. So really working with these young people in elementary school or in high school and helping them develop social skills is critical.
Interesting. Thank you so much for shedding some light on this for us this morning. We sure appreciate it.
Thank you.
All right.